Hey everyone, my name is Katrina. I'm a pelvic floor physical therapist, and in today's video, we're going to go over a few exercises that you can do to connect to your lower abdominals. This is especially really important if you are just beginning to connect to your core. So again, these are very simple yet foundational exercises that you can do, especially if you are pregnant and wanting to connect to your core, kind of support any aches or pains that you have, whether it's pelvic pain or back pain. And then also if you are very early postpartum, whether that is week 1, week 2, week 3, and really just wanting to start on some very simple yet safe exercises. So we're going to have you lay on your back. And we're going to have you have your feet planted onto the floor. And we're just going to start off with some basic breathing and then activating your lower abdominals. So we're going to have you just inhale and expand into your rib cage and your belly. Think about expanding and filling up this container 360 degrees. And then you're going to exhale, zipping up, pulling in lower, middle, then upper abdominals. You want to make sure that when you exhale that you're not overly gripping or rounding your back or flattening your back. There should be no change in your spine when you're doing this exercise. So we're going to have you inhale and then exhale. Inhale again, exhale. Now, how do you know if you're activating your lower abs? You should feel this zippering effect. If you place your fingers inside of these two pelvic bones, you should feel tension or muscle tone developing underneath your fingertips. So we'll have you inhale again, then exhale. You can also put one hand here, one hand here. As you exhale, this hand should pull in and then this hand. Inhale again. Exhale. Inhale. Exhale. Inhale. Exhale. So that's something you can start with. Second one you're going to do is you're going to have lifting up both of your feet. And you're just going to press one hand into your thigh as you press this thigh into the hand. So it's going to be like a pushing into each other. So you're going to push into the thigh is going to push into the hand as you exhale and activate your core. So we'll have you inhale, exhale, inhale again, exhale, inhale, exhale. If that's hard for you, you can even support both legs like this and exhale. If you need a little bit more support, you can even just do one side as well. The next exercise we're going to do is some taps, but we're going to do this again, adding in that pushing, that tension we're creating into the thigh. So we'll have you inhale, exhale, push your hand into your thigh, push the thigh into your hand. As you exhale, slowly lower your foot towards the ground, and then you're going to inhale, come back up. So we'll inhale, relax, exhale, inhale, exhale. Really feel those lower abs kick in. Exhale, inhale, exhale. Now when you're doing this, you want to make sure that when you lower the leg that you're not losing the neutral spine. So you want to make sure your spine is nice and neutral. Don't arch your back. Let's do the other side. Inhale, exhale. Inhale, exhale. Inhale, exhale. 2 more. Inhale, exhale. Inhale, 1 more. Exhale. Great. So those are a few variations that you can do to help, again, connect to your lower abdominals. Again, they are very simple exercises that you can do. You should not stop at just these 3 different progressions. So if you really wanted to strengthen your core, if you have diastasis recti, ab separation, incontinence, prolapse, you really want to expand upon these basic exercises. But I wanted to create this video as many of my clients were asking about just very simple exercises they can start with early postpartum that are safe, that they can do before their 6-week appointment. Again, this is not medical advice, so please consult with your doctor before you do these.